Give me the news. I've got a bad case of loving you. No pills gonna cure my head. I got a bad case of loving you.
All right, Coronavirus Journal Day 1. It is March 25th, 2020. I just finished my first of 7 shifts in a row here in Los Angeles, working the night shift, and overnight had only one suspected coronavirus case that we admitted. Relatively sick individual and relatively young. Patient has been admitted, and we are awaiting test results to find out whether this patient truly has the novel coronavirus. As far as I have been informed thus far, my facility has had several positive cases. There are many cases that are pending test results to find out whether or not they officially are coronavirus patients, and we have 2 critically ill coronavirus patients that have tested positive and are in our ICU in critical condition. Hospital's been relatively calm over the past few days, apparently, and overnight last night also, for me was very calm. We are fearing that this is truly the calm before the storm, as we are kind of in the thick of this incubation period with a large number of patients just now being infected. So we are fearing that in the next 7 to 10 days we are going to start getting inundated with patients that have this virus. Otherwise, neighboring hospitals have already been overloaded and overwhelmed. A nearby hospital, one of our competing hospitals, apparently intubated 5 coronavirus patients in a single day just 2 days ago, which is already coming close to pushing their capacity in their intensive care units, despite that hospital's size. So hopefully we'll be able to manage. Our facility, just like all the others around the country, is having shortages of various supplies, particularly personal protective equipment, or PPE, and we are trying to make do as we can, and we'll keep you updated on a day-to-day basis. All right, see you tomorrow. Hello, so this is Coronavirus Journal Day 2. It is March 26th, about almost 7:30 a.m. Pacific time. Hospital's been relatively dead, more so because everyone's avoiding the hospital unless they're severely ill, which is very refreshing, but unfortunately certain people are not showing up to the hospital for serious issues until it's too late. Multiple heart attacks have been coming in where people have felt their chest pain, and normally they would have come to the hospital, but they waited and waited and waited, and then by the time they got to the hospital, their heart attack was so far gone that lots of damage has been done. Overnight, all my patients that I admitted were all respiratory lung issues, all pneumonias, all suspected coronavirus patients. I personally had 3 of them. One of my colleagues overnight also had a couple, I think. Very ill, not yet ICU ill, but getting close to that intensive care threshold. And we'll see. Neighboring hospitals, competing hospitals, apparently have already started reaching maximum ventilator and ICU capacity. Been hearing some horror stories from these neighboring hospitals, particularly USC and UCLA Ronald Reagan, as well as various county hospitals. So it looks like this is the beginning of what is going to be a horrendous outbreak. So we'll see how it goes tonight. Yeah, that's it for now. Hey everyone, it is Coronavirus Journal Day 3. It is March 27th. It is about 7 in the morning, and I have just finished another shift here in Los Angeles County in Southern California. Overnight was a bit more hectic and difficult than the previous 2 nights in regards to coronavirus. We have admitted 6 more suspected cases, and one of those cases was critical upon arrival to the emergency department and is already on a ventilator. The remainder of our patients overnight are currently stable in regards to their suspected coronavirus infection. As for one of the patients that I admitted during my last shift that I spoke about on Journal Day 2, that patient was my youngest coronavirus infection thus far, and he declined rapidly after I admitted him. And I found out that while I was out of the hospital trying to get a little bit of sleep before coming back in overnight, his vital signs dropped steeply. He was not getting the oxygen his body and brain needed due to the damage that was being caused in his lungs. And so it was decided that he also required ventilator support and was intubated and is now on the ventilator. As I said, it's tragic. He's otherwise healthy, no issues, and he rapidly declined. So we're hoping for the best for him. Our ICU doctors, our intensivists are on the case, and we have the utmost respect for them, and they know what they're doing. So hopefully they can turn him around. Also, apparently I was told that while I was out of the hospital, our first coronavirus death has occurred at my facility. Although I have yet to verify due to the hecticness of this last shift. But we have an entire wing of our hospital dedicated to our coronavirus patients that are not in the ICU, as well as a separate area in the intensive care unit for coronavirus patients. And lastly, a wing of our emergency department is also now cordoned off to be separated and used solely for suspected coronavirus patients. Our testing is still very slow here in Southern California. My facility in particular has tons of money and resources and is part of a very large hospital system, and we are still struggling with testing here. From our standpoint, the health department requests that we go through a checklist here in Los Angeles County, and if our patients meet criteria on that checklist to be tested, the health department would do our testing for us, and the turnaround time for those tests was 3 days, but due to the increased number of infections and the spread of this virus, the health department appears to be somewhat overloaded, and it's taking even longer now to get test results from them. If our patients do not meet the health department criteria, at that point we are able to test them, but we have to use a private company. As you may have heard, LabCorp is one of these very large lab companies in the United States who we have partnered with. But when we send our swabs, they swab up the nose, like very deep up into the nose, or in the back of the throat. We have to send those samples all the way out to North Carolina to be tested. And the turnaround time for those up until recently, or until I last heard, was 5 days before we could get results. So, we are still struggling in that regard. But hopefully, it'll get better. I've heard one of our competing hospital systems here in Southern California has just started or just gained the ability to do their own testing in their own hospitals and facilities, and their turnaround times for testing are now less than 12 hours, which is amazing. So we're hoping that our system, with its resources and size, will also be able to do something similar in the very near future. So fingers crossed. And that's pretty much it. I just wanted to chime in because, unfortunately, when I have a bit of downtime, I check my phone and see what all my friends have posted on Facebook. And it's just, I come from the Deep South. I trained in Georgia. I've practiced in Memphis and Georgia and Tennessee, hence the patches. But a lot of these friends of mine are very conservative and right-leaning, which is fine. I have no problem with that. A lot of my opinions go both directions, so I'm not going to be political. But, when they keep boasting online that everything is going well and that, certain people are doing great jobs, I don't know if we can actually really believe what we're being told. And, I try to talk to them and no one listens, but I will let you know here. This is my N95 mask. It is the only mask that we can wear to prevent ourselves from being infected by airborne bugs, be them viruses or bacteria. And since UCLA and Princeton have figured out that this thing can live in the air for up to 3 days, this is what we need to be using, not the paper ones that are absolutely worthless. But I jacked this one from my facility 3 weeks ago, before the coronavirus scare was in full effect in the United States, just because I know from my microbiology background that this was likely going to be airborne. And so this is the only one. I've had to be reusing it over and over and over again. And despite what certain people have said on national television and online, these cannot be sterilized. They cannot be cleaned. They're supposed to be single use only. Studies have shown and proven that using anything like alcohol or bleach to try to clean these even once destroys the mask's integrity immediately. The tests also show that UV light can sterilize these without damage, but that test is done using E. coli bacteria, which are not airborne and are much, much larger than the virus particles from this coronavirus. So it's still uncertain if the damage that UV light causes to the mask is tolerable or okay for us in regards to coronavirus. One of the developers of the original N95 states that UV radiation or UV light is still damning to the mask immediately, so they do not recommend it. So, I come from this hospital system I work for is amazing. It's very well funded, very well organized, and very large. They have tons of resources, and we are struggling to get these. So wherever and whoever keeps claiming that if we need masks, we have them, and the government is helping us with the masks, be it the state government or the federal government, we are one of the hardest hit areas in California, and California is one of the hardest hit states in the country. So how we're still struggling to even get our hands on a second one of these in 3 weeks is, worrisome. So when certain people, friends, personalities on television tell you that everything's going well and that our doctors and nurses are safe and they're, getting the protective equipment they need, they're lying to you. They're absolutely lying to you. And they're putting my health and my family's health and my colleagues' health in danger. And they don't care. As long as you're happy and think that things are going okay, they'll lie their asses off because they don't mind us dying. So, on top of the fact that I'm at higher risk because I kind of think this virus is racist because it seems to kill lots of Persian doctors, or so says the Iranian government, as almost a third of their deaths tend to be medical personnel. So, maybe it's just because my nose is so big it makes this mask difficult to seal. And, particles can get in that way. Who knows? So, try to make light of a bad situation, but, we do what we can. So, that's it for me. I will go home now, try to get some rest, and come back tonight and do it all over again. Later, guys. Good morning. It is Coronavirus Journal Day 4. It is March 28th, about 6 in the morning. Slowly finishing up my shift at the hospital. And things are starting to get a bit more hectic, amazingly enough. Somewhat predictably, but at the same time, been admitting more suspected coronavirus infections to the hospital, some of which are progressing to worsening illness and requiring intubation and being put on ventilators. Another young patient I recently admitted, has coded 3 times this evening, which means that their heart stopped beating and that they were on the verge of dying. And it was our attempts to resuscitate said patient. Unfortunately, due to long wait times, we still do not know if this patient is positive for the coronavirus, although everything points to yes. So multiple patients of mine thus far continue to get worse despite aggressive therapy, and patients continue to come in. The only silver lining to this cloud is currently, as I noted before, the hospital's admissions are much lower in terms of overall number because people that are usually here for whiny, garbage complaints like a painful tooth or a toe ache or chest pain that lasted 2 seconds 1 week ago are not coming to the hospital anymore. It seems like many of these patients are afraid to come with their minute complaints, which has kept our volume low in the emergency department, in preparation pretty much for this surge that we're expecting in the next few days. But other than that, the only news we have is that the USNS Mercy hospital ship has parked just a little ways down from us in Los Angeles Harbor, and we're hoping they'll be able to help us with some of our patient loads. But despite having arrived, I do not know of any communication between the Navy or the government with my hospital and the other two hospitals that are closest to this ship. I work at two of the three hospitals that are closest to the ship, and yet we haven't heard heads or tails of any plan as to how to utilize this resource. So it's here, but it looks like for now it's just for show. Beyond that, I think that is all I have to report. Yeah, hopefully we'll be able to share some good news, although it looks pretty bad elsewhere. I have friends across the country, particularly in Georgia, where I initially trained after medical school, and a hospital system in southwestern Georgia, in Albany, Georgia, is on the verge of collapse due to the coronavirus. They've had multiple deaths. They are the highest per capita area of infection in the United States, and are fourth in the world in terms of areas per capita that are having infections. So my heart goes out to them. They're attempting to move patients all over the state to assist with the crazy patient load that they have, and they seem to have maxed out and run out of ventilators from what they have told me. So unfortunately, they are now at an impasse, and things can really only get worse from that point down there in southwest Georgia. So my heart goes out to you guys, wishing you the best. Georgia has actually started asking for assistance from doctors from all over the country, even semi-retired physicians, due to an absolute shortage in areas outside of their two major cities of Atlanta and Savannah. So hopefully they'll be able to get some. Unfortunately, due to my workload here, I'm unable to assist anymore in Georgia, but hopefully other physicians will be able to heed that call and assist where they're needed. But that'll be it for me today. Stay safe, stay breathing, and we'll update again tomorrow. Good morning. This is Coronavirus Journal Day 5. It is the morning of March 29th. My shift is about over. Fortunately, once again, our facility appears to be relatively calm for the time being. I have personally only admitted one coronavirus rule-out patient. This patient has come in with symptoms and findings very likely to be coronavirus, and so patient has been admitted to be ruled out. Unfortunately, testing is still difficult to come by here in Los Angeles altogether, and my facility is working ridiculously hard at trying to get us access to testing directly here at the hospital. As I've mentioned before, we're still trying, we still are testing by sending our samples to a private corporation across the country in North Carolina, and that's taking at least 5 days to get results. So good news is that the FDA just approved 2 companies to do what we call point of care testing that can use blood from a finger prick to figure out whether or not you have the virus within about 30 seconds to 1 minute, which once that comes around, it'll be amazing. But for the time being, we don't have that kind of access, but we're still hoping that we can at least get in-house laboratory testing so that our people here on campus are able to get us results much, much faster. Um, Otherwise, things are quiet. The emergency department and the hospital are running like a facility is supposed to, with very few patients coming in unless they truly have medical issues. But I just realized I bitched about this in the past few entries, so we'll skip this. Otherwise, so far so good. It is Sunday morning. I'm going to go home and pass out so that I can come back again tonight once again. Trying to think. That should be it. Overnight, we've been keeping a tally, an hourly tally using the Johns Hopkins map for the coronavirus, and between the hours of 1 a.m. and 3 a.m. Pacific time, there were more than 20,000 worldwide cases of coronavirus reported. So it spreads ridiculously fast, and it's doing a lot of damage. So hopefully I'll be able to make other videos soon that are not journal entries and more explanations of certain parts of the virus and, the news behind the virus. But for now, just the journal entries. So that's it. We'll record something again tomorrow morning. All right. Good morning. This is Coronavirus Video Journal Day 6. It is the morning of March 30th, just before my shift is about to end. Tonight was a much more interesting night than the last 5 have been. I personally admitted 3 more coronavirus patients, and my partners also admitted a handful, all of which are very likely coronavirus cases, given the severity of illness. I'm still waiting to hear back to see how many deaths we've had, but all the patients I've admitted thus far, we are still waiting for results of most of their coronavirus tests. But one of my coronavirus patients had their heart stop beating and coded, and we were able to get that patient back and put that patient on a ventilator, and we're waiting to see how this patient does. Patient is on ridiculous amounts of medication to try to keep blood pressure stable, but so far it's been very difficult. As for another one of my patients, fun story, patient purposely tried to spit on me with the stated intent of infecting me with the coronavirus. Obviously, this patient is not mentally stable. And once we told the patient why we were admitting her, that's what happened. Good times. Otherwise, other news from this area, a number of nursing homes apparently have had the virus spread through their ranks, both staff as well as residents, and so we're waiting to see exactly how bad their infections are, but it looks like a large number of staff as well as residents are infected and getting worse. Trying to think if there's anything else as of yet. Our testing is still not great. We found out that all the tests we're using are only 70% effective, so it's pretty much like our flu testing that we've been doing for years. We don't really trust it all that much. At least with the flu test, if you tested positive, it was guaranteed that you had the flu pretty much, but we're getting a good number of false negatives with our current coronavirus testing. Otherwise, we are not actually testing very much at this facility. Tests are still hard to come by. we are able to send out for the coronavirus testing, but again, that's still taking us 5 days to get results. Public health department is still the same, and they are the ones who have the government issued test kits from the CDC, and they're taking 4 or 5 days, and they're so slammed that we've given up on them. And we're actually not testing patients unless they're going to be hospitalized. If patients come in with mild to moderate symptoms, we tell them to isolate and self-quarantine at home and only to return to the hospital if their symptoms worsen. We are giving them pulse oximeters, on the little things on their fingers so that they can check their oxygenation levels at home, and if they reach below a certain point, they can come back to the emergency department for admission. Otherwise, we're not testing them. So the testing numbers that you do see, especially for the United States, are not accurate because this is the new practice that's been going on throughout a large portion of the United States. If it's not going to affect, if the result of such a test is not going to affect the management for the condition, we don't do the test. So if you're not sick enough that you need to be in the hospital because you're dying, we don't test you. We just send you on your way. And like I said, most of the patients I've admitted this week that we suspect are infected, we still haven't gotten the results back for their tests. So, but yeah, on a personal note, I know many of you don't care, but physicians and nursing staff have been putting themselves on the front lines of this outbreak, and it's been found out that we are in much more danger because of what we do. The more virus that we possibly are exposed to and inhale, the sicker we can be. So there's a reason that doctors and nursing staff and medical staff tend to get much sicker than the general public is. And we're doing this without hazard pay. We're not getting anything beyond what we already get paid, et cetera, et cetera. But we all do this. We got into this field for things like this to help, especially when it's really needed. But to be insulted by the President of the United States yesterday, when I woke up, I saw the press conference, and the President has accused physicians and nursing staff of either stealing or hoarding the personal protective equipment that we've been begging for. I still have my mask, and I've had it for over 3 weeks. But apparently, despite all the work we're doing and the sacrifices we're making, both professionally, with our lives possibly, and our families, we're still getting insulted by the person who runs our country now. And that's just fucking disheartening. It really hurts. We try not to burn out. We try to keep positive as much as we can. And just to have someone just outright call us thieves? For what? Because someone doesn't understand the math of a pandemic. Hospitals in Manhattan have been using 20 to 30,000 masks per week on average before the outbreak started. Now they have a true outbreak, and each hospital is needing 200 to 300,000 masks per week all of a sudden. That's just 10 times more, even though they have hundreds of patients that they now have to take care of with this virus at a time. Obviously, if all they need is 10 times more, we should be counting our stars, lucky stars, thanking whoever you want to thank up, above, that's all they're using, because they could be using a lot more, taking into account how many people they're dealing with and how much we're supposed to be using, because we're supposed to be taking these off and throwing them out after each patient we see, and obviously that's not happening. So it sucks, and no one's there to defend us. the American public. I don't hear any outcries about the comment. The American Medical Association, which is supposed to be backing physicians, not a peep. And they expect us to pay them so that they can represent us in Congress and stuff like that. Even nursing unions, which I thought would be outraged, haven't heard anything yet. When you insult a single nurse, you insult the whole country's nurses, and yet nothing. So, thanks, America, for letting everyone, I won't say everyone, thanks for letting one man shit on us and letting at least 35% of the population, which kisses his ass, to agree with him that we're stealing. It's ridiculous. But anyway, politics aside, things are starting to heat up in California. We're getting more cases. And still waiting to hear about how this USNS Mercy hospital ship is supposed to help us. It's been parked in the harbor for 3 days now, and we ain't heard heads or tails of how they plan on actually helping us logistically. We know the plan, but the military hasn't contacted anyone around here. The government, the NIH, the CDC, FEMA, no one has contacted the hospitals in the area to let us know how we can utilize this resource. So anytime you hear someone say, oh, we're ahead of the game, we're using Navy ships and this and that, bullshit. Bullshit. We're getting no help. My hospital system is scrambling to try to get us everything we need. But no one else seems to be. So, thank you, America. Oh yeah, and in Mississippi, prayer apparently is supposed to be curing the virus. So, lastly, studies have been coming out of Louisiana and New York City that show that hydroxychloroquine, the miracle drug that the president touted, is worthless when it comes to this disease. It hasn't helped one iota, and they've been using it on everyone. My hospital's been using it, hasn't shown any signs of helping anyone. Same with the antibiotic that was supposed to be combined with it, not helping anyone who's got this. So, ta-da, moron. Stick to your job. Don't try to do the science. You don't know what you're talking about. Let us do the real work. All right. That's the end of my rant today. I have one more shift left this week before I can try to take a breather and unwind. So, good morning, everybody. It is Coronavirus Video Journal Day 7. It is the morning of March 31st. My shift is just about over. It has been quite the hectic night this evening compared to the previous evenings. Multiple coronavirus patients have been admitted tonight. My overnight shift, we've admitted, I believe, 6 coronavirus patients overnight, and throughout the day, several more before I got into work. Of all of my admissions, I think I only have probably 1 or 2 that are relatively ill. None have required ICU admissions, but I have a feeling that 2 of the ones I've admitted are probably heading in that direction. Other than that, it's just been kind of refreshing to see some patients, more patients coming into the hospital for routine complaints and issues, which is also concerning to a degree because some of these complaints that they're returning for are, as our usual, just BS and don't need to be seen in an emergency department. So there's some concern there that maybe people are lowering their guard in regards to the coronavirus, and that means that likely there are a growing number of people who have started not practicing their social isolationism. But other than that, this will be a brief one. just because I don't really have much to talk about. But, oh, I did want to bring one thing up. All right. Quick thing. See these guys, the paper ones that go around like your ears? Like that? Yeah. These are considered surgical masks, and they don't work. They are intended solely so that someone like me who might be sick doesn't cough or sneeze or some crazy, hilarious, stupid thing onto a patient that's being operated on in reality. But due to the fact that the coronavirus is likely airborne, despite what the CDC would have you believe, these guys won't work. Simple. The ones that will work, ooh, are these guys. There are multiple versions of the N95 mask, but the N95 is the only one that will truly prevent infection with the coronavirus when worn, if worn appropriately. The key to this one, you wear it, and this metal band is supposed to help seal it over your nose. And for someone like me who's Middle Eastern, big nose, so it's kind of difficult. But if you breathe while wearing glasses, for example, you should not fog up. If you are fogging up, it's not sealed correctly. So see, mine's not fogging. So it works, even though this one hasn't even been, pulled over. Nonetheless, now the CDC guidelines state I should wear this and then put this over it so that I can reuse this guy. But based on what I've already told you, the coronavirus is so small in particle size, it will go through this. So what the hell is the reason for putting one over the other when by definition it'll go through this and onto this as if I never put anything else over this? Why? Because they're desperate. So they are desperate to try to convince healthcare workers that they can be protected and do things that we were taught never to do, like reuse these masks. So that part of it is kind of hilarious, but I figured you should know. So if you have a mask like this, don't wear it in public. It's stupid. It doesn't work. It's just a waste of your money, a waste of your time, and it can be kind of uncomfortable. Not nearly as uncomfortable as a true N95, but still really stupid. So all the people you see, especially like in Asia, stupid. And so, yeah, we see a lot of people here wearing them, and we're just like, you're an idiot. So, nonetheless, that was the only thing I had to present today. It was kind of stupid and funny, but I just laugh whenever I see people wearing them, especially outside of the hospital. It's just like, oh my god, stupid. But that's it. So I'm off. The yellow scrubs, if you don't know, represent the last shift of my week. I always wear them just to let the world know that I'm fed up and I'm tired and don't mess with me because I've been working too hard for too long. So I will be off for 9 shifts and we'll be back in next month officially. For another stretch of 7 in a row. So we will work on my website, my YouTube page, and hopefully by that point have something up, and otherwise start reposting journal entries once I'm back in the hospital. So good luck, stay safe everyone, practice your social isolationism, and we'll talk soon. All right, later.